Hey guys, my name is Kevin. I am one of the exercise specialists at the West Primary Care Network. So today we're going to be going through a bunch of hip and knee arthritis exercises. At the West PCN, we teach the GLAD program, which is good for hip and knee arthritis. Unfortunately, that program is really done with the feedback of an instructor. Like, a really important part of that is a qualified instructor giving feedback on how to do stuff. So during this COVID outbreak, this is the best we can do. So I'm making this video so that you guys can see how to do some good hip and knee exercises from home, but it does not replace the GLAD program by any means. Also in GLAD is 2 educational videos. So these are the exercises that I am comfortable with people doing from home, and really do them as good as you can. Key points are as if you start to develop more pain when you're doing it. Let's say you start the exercise program with like a 3 out of 10 pain. If you're doing repetitions and your pain starts to get worse, you need to stop. It does not help you to push through pain, okay? That's the main indicator that I'll be looking at, or that I would recommend. So I'm going to show you these exercises that you can do from home, and they are really, overall, the big thing with knee arthritis is make your legs stronger and also learn how to use your glutes. So I'm going to teach you guys really squeeze your butt during a lot of these exercises. If you can learn how to use your glute muscle, it will offload your knee and it will better support your hip. So that's a big portion of the program. But here's 6 exercises that you guys can get started with at home. And yeah, and then I'll teach you progressions for every exercise. So here we go with number 1. Okay, so here is the sit to stand exercise. I'm going to show you guys easy, medium, and hard for this one. So basically, when we do a sit to stand, the higher the chair, the easier it is, especially on your hips and your knees, and you'll find it easier to activate your glute muscles, which I'll talk about. So we have these chair lifts. Not everybody has these at home, but we get to use them here. So just find the highest chair that you can find, basically. So when we do a sit to stand, I like to sit on the edge of the seat. Higher the chair, the easier it is. I put my hands out in front of me or somewhere around here, just in front to counterbalance your weight. Squeeze your butt first, push your hips forward, and sit back down. And squeeze your butt, push your hips forward, and sit back down. When we do a squat, we are using, or a sit to stand, we're using our quadricep muscle as well as our glute muscle. If you don't think about using this, you won't. You're primarily going to feel it here. So I need you guys to think about using this before you push off. So squeeze butt, push hips forward, back down. Another thing I'm looking for during the squat or the sit to stand is that your knees don't collapse inwards. So if you stand up and your knees go like this, that's no good. Okay? I want to keep your knees over top of your second toe. That's about where I want to keep them. Squeeze butt, push hips forward, back down. Now from there, that's how to do it. The way we make it harder is the lower the chair, the harder it is. So standard chair height, we're gonna sit on here, squeeze your butt, push your hips forward, sit back down. Your feet can be about hip width apart. Do what's comfortable for you. A little bit wider, a little bit more narrow is fine, as long as you are squeezing your butt and keeping your knees over top of your toes. We wanna try to get to feel it in our butts, okay? The next hardest version is going to be down at our feet, so I want you to stagger your feet. So your back foot is going to have to be farther back than your front foot. Okay, so from there, for me it'll be my right foot is the harder one, left foot is not going to be working too much. Right butt squeeze, push hips forward. You'll be quite surprised how much of your right side you use. This, I feel like I'm working about 80% my right leg, 20% my left leg. So right butt squeeze, back down. This one we do need to do on both sides. So switch legs, and then I'll do my left leg. Squeeze butt, push hips forward, sit back down. Once again, watching this knee, don't let it collapse inwards like that. I want to keep it out there, okay? Up and down we go. So that's the sit to stand exercise. That's exercise number 1. The next exercise is going to be a step up. So for this step up, basically in your house, if you happen to have a step, then that's great. I actually built some steps at home that I could have different heights of out of just 2x4s, 2x6s, and plywood, if someone at home is handy. Otherwise, you can just use your staircase if you have stairs at home. So basically, this is just stair climbing 101. What we're really trying to do here is ideally learn how to use your butt to climb stairs. So your glute muscle's job is hip extension. So if we just look at the hip muscle, or the hip joint, I guess, is back and forth. The glute's job is to push your thigh bone backwards. You really need to wrap your head around that. This applies to both sit to stands as well as climbing stairs. Is what does this muscle do? It pushes the thigh backwards. So when you're climbing stairs, most people, if they climb a bunch of stairs, they're going to complain that they feel it here. I want you to learn how to feel it here. So basically squeeze your butt first and then up and down, always holding on to something when you're doing the step up. Up and down. Other thing is I don't want you climbing with your toe. I want your whole foot on the step. So squeeze your butt up and down, all on the same foot. Okay? So that is one way to do it. If you have trouble feeling it in your butt, then I'll get people sometimes to prime what does this muscle do. So I'll get you to bend your knee, keep your knee bend the same, and you're just practicing bring the knee forward, push the thigh backwards. Bring the knee forward, push the thigh backwards. And we're trying to feel it here when we do it. Okay, so butt muscle's job is push thigh backwards. And then once we start to feel it in here, then we can switch to just put your foot on and go. And then you should be able to go up and down using that. Okay, so we'll do as many as we can on one side and then switch to the other side. If you need that primer again, you can do a couple like that. And then once you feel it in your butt, squeeze that butt and up and down just like that. Okay, so that is the step up. If you start to develop any knee pain, then that is enough. And the other thing I'm looking for is don't let your knee collapse inwards when you're doing this. I want your knee over top of your second toe. So we call this good knee alignment. Don't let it collapse in. Keep it here, up, down, down. Okay, so that is the step up exercise. This next exercise is going to be the knee extension. So the knee extension is really a quadricep muscle exercise. So it's going to be that muscle on the top of your thigh bone. What we need to do is get some bands and tie it around the back leg of a chair. Ideally, I want you sitting up higher if possible. Once again, same as the hamstring curls, I want your legs to be dangling. That is so that you don't have to lift your leg and then extend, because now we're extending our knee and our thigh bone isn't really stable. If you can, and you can be sitting, now my thigh bone is totally like flat and stable and I can just extend back and forth. So the way that we do this is quite difficult for a lot of people, but if you can reach down, step one, just get your foot through there, and then once it's wrapped around your shin, grab it and twist it so that there's a little hole for your foot to go through. I'll tell people plant your heel and lift your toe, and then wrap it around your toe just like that. Hard part's done. Now the easy part, extend your knee forward and let it come back. Extend your knee forward, let it come back. If you need harder than this, you can wrap 2 bands around your foot like that. I will make a point, if you're doing your right leg, you should wrap it around the right chair leg. If you're going to do your left, you should wrap it around the left chair leg. And don't have the band go outside of the chair leg, otherwise that's going to be pulling your leg out to the side. So straight forward and back like that. As many as you can. If you can get to 20 with no knee pain, and everyone is full extension. A lot of the times people, as they get tired, they don't go all the way out. So you got to go all the way, all the way, all the way, all the way. Okay? So as many as you can on your right, as many as you can on your left. This one can cause some pain in people with knee arthritis, so only do as many as you're comfortable doing, and don't overdo that number to cause any pain. Some people just can't do this with a band at all, so feel free to just have no band and just do this knee extension as well. Okay, so that is the knee extension. So the next one is the leg curl. So the leg curl, we're going to need an anchor in front of us, tie the elastic around it, and we're going to be pulling our leg backwards using the hamstring muscle in the back of your leg. So for this exercise, the setup, same as the leg extension. I want you sitting up higher if possible. I want your legs dangling. That basically makes it so that we don't have to lift our leg before we pull. Basically find something in your house that you can tie an elastic around. You guys should have some of these at home already, but you could use like a weight bench, a treadmill, a bike, something like that. Or if you have a handy dandy colleague around, this is my colleague Terry, so she's gonna anchor the chair for me. So from here, basically, I'm gonna grab the green one and wrap it around the back of my leg. Scoot your butt to the back of the chair. I want your knee, like your joint, to be pretty close to the edge of the chair. So usually if you just sit all the way to the back of the chair, that's the best. And then pull back, hold it for a half a second, let it go forward, pull back, hold for a half a second, forward, and that is the leg curl. So we're gonna do as many of these as we can. If you can get to 20 with no pain, no problem, and good range of motion. I want you to be able to get all the way this way, all the way that way with every repetition. If you can do more than 20, it's time to move on to the next level. So next level for us is the red band, and you might need to scooch to the right a little bit. Oh, it didn't move good. So this would be the harder version. If you want to go harder than this, you can go red plus yellow as well. Okay, so that is the leg curl. This next exercise is going to be the leg abduction, abduction. So basically what we're going to do is take a band and we're going to tie it around your legs. So put your legs together. We want to tie it fairly tight. These bands don't work to like tie a knot and pull like it's a shoestring. That's not what we're looking for. It's better to stretch the band first, and then as soon as that contact point is made, the band will pretty much stick there. Make yourself a knot. Once again, like if I pull on these types of bands, it doesn't really work, so it needs to be tight to start with. And then just loop it around again so that, I guess, the knot stays. So there we go. Now we have it tied around. I'm going to move the chair over here. I like to do this one while you're holding on to something. So hold on to something on the left, and basically all we're going to do is push out to the side, come back. This is working your gluteus medius muscle. So it's kind of the middle butt muscle, out to the side and backwards, out to the side and back. So I'll do as many as I can on this side, up to 20. If I can get to 20 easily, you could tie a second band around your leg. And that would be the next level, or we go yellow, green, red for the bands that we have the West PCM. Once you're done on the right side, then switch over to the other side, and you'll do your exercises from that side as well, or your leg abductions. And there you go, that's the leg abduction. Hey guys, this next exercise is the glute bridge. So the glute bridge ideally takes place from the ground. You can do it from your bed. I find it better from a hard surface, but if you can't get down to the ground, we'll do it from the you can do this from your bed. Best way to lie down, rather than lying down this way, can be kind of hard on your back. Best way to lie down is onto your side like that, and then roll over. So now that we're here, I like to have my feet as close to my butt as I can, but feet are still flat on the ground, not halfway between the mat and the ground. I'm going to put my hands flat down on the ground, and I want you to do a little bit of abdominal bracing. So squeeze your belly just a little bit before you lift up. And then from here, we're going to squeeze our butt, push your hips up to the sky, hold for 2 to 5 seconds, and then back down. And then squeeze your butt again, up to the sky, hold for 2 to 5 seconds, back down. We're going to do this up to 5 to 10 times. So 5 to 10 repetitions, 2 to 5 second holds. Okay. Squeeze your belly. Your belly's basically staying a little bit tight to support your back throughout the whole exercise, the whole time. Belly, butt, up and hold. We're going to do this about 10 times. Okay. Once that starts to feel really, really easy, and you can do that in your sleep, you can try to move into the next harder version of that, which I do the one-legged glute bridge. So from here, we're going to squeeze our belly, squeeze our butt, push your hips up, and shift your weight over to one side. Now I want you to feel that side's glutes should be working way harder, and then shift your weight onto the right side. And now I should feel my right glute working a lot harder. Belly's tight during all of this. If you feel like you're ready, shift your weight onto your left, push that left, really pushing hard with the left butt, and your right leg comes up off the ground. and then shift my weight back over, right butt, lift that leg into the sky, hold for a couple seconds. So that's twice as hard. If you're just getting into this, don't do that one. You should be doing this for at least 3 weeks to a month before you even think about doing this one. Okay, so that's the glute bridge with an idea of how to advance it to harder versions. So the next exercise we're going to do is the counter plank. So the counter plank is the first of our core exercises we do during GLAD. So find a counter. Basically, the higher the counter, the easier it will be. A table is a couple inches lower, so that'll be a little bit more challenging. So pretty simply, put your hands together and lean over on top of the counter. Elbow basically right on top. I want your shoulder to always stay above your elbow. And then from here, basically just walk your feet backwards. And we want a nice straight line between our shoulders all the way down to our heels. It's okay for your heels to come off the ground. You don't need to put your heels on the ground. That's just stretching your calves. Sure, if you want to stretch your calves, that's great, but this is a belly exercise. So what I want you to do first is squeeze the belly a little bit before you walk back, and then we're going to go to here, and then we're going to hold this for as long as we can. If you can hold this for 60, maybe up to 90 seconds, you're ready for the next level, which is going to be the kneeling plank. So the next level is going to be the kneeling plank. So we have to be able to get down to the floor for this. You can do it from your bed. Yeah, it's okay to do it from your bed. It is better off of a hard surface though. So basically what we will do is, best way to get down onto your belly is to land your side first. It's just a little bit better for your back. And then onto your belly. Once again, shoulders are going to be directly over top of your elbows. Clasp your hands together. Squeeze your belly and then push your butt up in the air just a little bit. So I don't want your butt way up in the air, and I also don't want your lower back sagging. We should be about right here, and keep your belly tight the whole time. If you can hold this for up to 60 to 90 seconds, you're ready to do a foot plank. So all the way down to the feet is suspended, and then you're going to hold this for as long as you can as well. If you can hold this for 90 seconds, then you're an absolute all-star, and you don't need to do this anymore. I'm just kidding. Keep on doing it. But that is level 1, 2, and 3 of the plank. Okay, and that's the last one. So thanks for watching, and this has been the hip and knee exercises with the West PCN.